Good afternoon, everybody, and welcome to today's webinar. My name is Janice, and I will be your host for the next hour. And today we're going to explore the difference that volunteers make to our NHS services. And I'm really pleased that you're able to join us today. Before I get us started and introduce you to our speakers, just a few points to mention. So today's webinar is being recorded, and it will be made available on our website afterwards. Up until the Q&A session, your camera and your mic will be switched off, and we'll have Angela here as our chat box host. We really want to be able to encourage you to participate, so please do put your questions, comments and reflections in the chat throughout the session, and Angela can put as many of them as possible to our guest speakers during the Q&A. So 5th of December every year is the United Nations International Volunteer Day. And this year's theme is centred around collective action and imagining a world where everybody volunteers. And that theme led me to have a bit of a think about, imagine the difference that we could make if everybody in Scotland, all 5.5 million of us, decided to volunteer their time for their local community. What a difference that would make. But for today, let's focus on our health and care system in Scotland. Each month, thousands of people give their time to support NHS services, but how many people really know what it is that they do, and more crucially, the difference that these volunteers make? And so to help us to answer that question, I'm really delighted to be able to introduce to you 3 clinical staff from across Scotland who work alongside volunteers on a regular basis. And they're going to share with you today the difference that volunteers make to them, their colleagues and the patients that they support. And so just before we begin to dive into their experiences, what I want to do is to ask each of our guests to introduce themselves. So Lynn, can I come to you first? Switch on your camera for us and introduce yourself.
Hi, that's working, I take it, yeah.
Yes.
Good. So hi everyone, my name is Lynn Sutherland and I am the Complementary Therapy Coordinator in NHS Tayside, working in Dundee Specialist Palliative Care Services. I'm an occupational therapist by background and I'm also a trained complementary therapist myself. So I have a responsibility within our service to the patients and their families in our inpatient unit, day services, outpatients and in the community. So I support volunteer complementary therapists on a daily basis, and most of the therapists provide therapies within our day services. I would like to say that the complementary therapy service would almost be impossible to function if it wasn't for the volunteers. And some of the volunteer therapists have been providing therapies for 15 years or so, which is phenomenal. I've come to know them all really well and completely appreciate their kindness, compassion, and their willingness to share their skills and to enable our patients to enjoy and benefit from therapies. And the therapies they provide are mainly massage and Reiki. But they enhance the service without measure, and I see that on a daily basis with the patients that they treat and those patients and families that are in our service.
Brilliant. Thanks very much for that, Lynn. I'll look forward to diving in a wee bit more to some of your experiences in a wee bit. But next up, I would like to welcome Monica. Monica, would you like to switch on your camera for us and introduce yourself, please?
Can you hear me?
We can.
Wonderful. So I am Monika Gazda, and I am activity coordinator, which is official name. Unofficial name is recreational nurse, which I prefer much more. And I'm located at Blackford Wards, which is APCU, Intensive Psychiatric Care Unit at the Royal Edinburgh Hospital. It's a highly secured unit with increased level of risk and highly distressed patients. That's why activities are playing a massive role in our wards. But speaking about activities, we need to mention about volunteers who are playing a massive role in our activity timetable. As let me introduce activity timetable, which we have in the Blackford ward. We've got 2 group activities every day, one in the morning, one in the afternoon. And we've got 3 volunteers who are coming every week regularly, and they're part of the team and they are part of the schedule. Nothing that wouldn't happen if not Edinburgh Volunteering Hub. I need to mention about those 3 lovely ladies who are working at the Edinburgh Volunteer Hub. It's lovely Chloe, Katie and Mary. And Edinburgh Volunteer Hub is the 3rd sector project, which is located at the Royal Edinburgh Hospital. And that's the project which engages both patients and members of the public and volunteering. So Blackford Ward, myself and NHS is a partnership between us and Edinburgh Volunteer Hub, and with those 3 lovely ladies who are a massive support and help. Thank you.
Thanks, Monica. I'm really looking forward to hearing more from you in a bit too. Okay, and finally, could I welcome Vicky? Vicky, if you would like to turn your camera on and introduce yourself. Thanks.
Hi everyone, my name's Vicky. I'm the Surgical Acute Frailty Advanced Nurse Practitioner here in Ninewells in Dundee. The Surgical Frailty team is a liaison service which supports the care of the perioperative sort of journey for our patients across surgery and unscheduled care, so emergency admissions essentially. So we have a team of 5 volunteers that work with us, and we're so pleased to have them. They're activity based across the wards, and they're just able to spend some wonderful time with our patients, making that huge difference to each patient and also just to the ward team as well by uplifting the patient's day. It really makes a big difference into their continuation of sort of ongoing rehabilitation as well to the patient. So it's great for us to have them, but also for our patients to really benefit from them. They use colouring books, quizzes, games, bedside crafts. Who knew that you could make pom-poms with a fork? And reading and talking to patients about their life experiences and their time within the hospital. So thank you to any volunteers that are listening at the moment. Yeah, you do a great job. Thank you.
Brilliant. Thanks, Vicky. And here in your comment, a big thank you to the volunteers. And I should say the eagle-eyed among you may have noticed that we've been missing a guest speaker. Unfortunately, Pamela Lawless was unable to join us this afternoon, sends her apologies, but she has been a bit busy on the ward today, and so hasn't been able to join us. Okay, so we've got some questions. This is in conversation. So we want to be quite relaxed and quite informal. And so I'll come to you, Lynn, first, if that's okay. Could you maybe give us a wee bit more of an insight into what a typical day, if there is such a thing, where you work regards, you know, the work that volunteer therapists do and how you support them?
Okay, so yeah, you're right. There's not a typical day. Like in most hospital settings, we're not any different from that at all. So at present, I have around 8 volunteer therapists, and they commit to regular sessions within our service. Normally, they would volunteer once a week, but there are some volunteers who volunteer when they're able to, on an ad hoc basis, and those are absolutely equally as valued as volunteers that come in once a week. So we have Reiki and massage therapists mainly. All the massage therapists that we have been oncology trained, so that they know how to deal with our patients and what's safe practice. I'm always around to ask questions and help with manual handling and that kind of thing. You know, for getting patients onto couches and that sort of thing too. We have a new volunteer who is going to be doing hand and nail care, and we have a new therapist who provides oncology massage and luxury facials. We've had a few staff members who've had a little trial run, and that's going to be very much in demand. The patients are going to have to elbow the staff out of the way, I think, for that. But so that's wonderful. Our volunteer therapists generally commit to a 2.5-hour session, and normally in that time they'll see 3 patients or so during that time for around about a 45-minute session, sometimes longer, sometimes shorter, depending on the needs of the patient, because as you can imagine, some of our patients are very symptomatic, frail, fatigued, so are unsure how they're going to cope within a therapy session. But all the therapies are really adapted. It's all very gentle, and once a patient has had a session, normally very much in demand for more. I guess the reason we don't really have a typical day is really around the nature of the patient group, because it can often mean cancellations, people are poorly, and just general changes within the environment we find ourselves in. So the therapists from quite early on really come to realise that they really need to be quite adaptable and flexible. And it is really my role and the role of the day services team to try and maintain that good communication and support them in whatever way we can.
That's brilliant. Thank you for that. I didn't think that there would be a typical day per se, but I mean, really kind of interesting there to hear you say there about that you've got people who volunteer regularly, but also people who maybe don't have the same time free every week that they can come and volunteer with you flexibly as well, which must open it up to a wider group.
It certainly does, and sometimes it's a case of a therapist, really wants to volunteer, but is only available on, certain days, over the course of the next 3 months, school term time or whatever. So it's a case of me coordinating the patients around the dates available and that kind of thing. So yeah, we make it work.
Excellent, thanks very much, Lynn. We'll come back to you again in a wee while, Lynn, okay. But if I can move round and ask Vicky the next question. So your service is surgical frailty, and so in my mind that conjures up a kind of assumption of older adults. I wonder if that's correct or not, and would you be able to give us a bit of an idea of the types of patients that you're supporting and who comes along to volunteer within your service?
Yeah, of course. So yeah, you're correct in your assumptions that frailty does sort of conjure up the older adult. So it's patients that are over 65, and we use a sort of clinical frailty score tool to sort of see them. And while our volunteers focus on the patients that we have on our list, because they tend to be longer stays within the hospital, so a much longer time they spend with us, that doesn't exclude them from seeing the other patients that were in the ward. So our service covers 5 wards, so we cover 130 beds. So it's quite a lot of people to get round at any one time, and they can be varying age from 16 to 100. So yes, our volunteers, we have 5 volunteers that work with us, and they range from still, I'll not mention ages, but they range from still being at high school, so their last year at high school, and similar age to myself in their 40s. And I think that wide age range is really quite beneficial because they'll be able to speak to different people at different times. And they will go into the wards, but as I say, they may sit and speak with a patient or sit doing a craft like the pom-pom forks, which Val's going to produce the instructions for everybody because I know you're all keen to do it now. But I remember seeing Claire walking past that bay and she'd got the whole bay doing it. So not only has she managed to engage a lady who loved to do crafts in her time at home, so they brought that in for her to do while she was in hospital, and yet the whole bay, the whole 6-bedded bay, ended up making pom-poms that day. So yes, they primarily see our patients that are frailer and older, but they will see anybody that are on the wards. So it's brilliant.
Brilliant. I've got just such an image in my head of everybody making these pom-poms, and I'm one of the ones who want the instructions as to how to do it. My kids will love it.
Great for Christmas.
Great for Christmas. We'll make all sorts of decorations. Brilliant. Thanks for that, Vicky. I'll come back to you again in a wee second. And so, Monica, your environment is maybe a wee bit different, and so I can imagine that it can be quite challenging to manage volunteering opportunities in an intensive psychiatric care unit, but it must be a really worthwhile investment of time. So could you tell us a wee bit about what are the benefits to you and your role and to the other staff that you work with in the unit?
Of course. You're absolutely right, considering that intensive psychiatric care unit is has an increased level of risk and quite often has highly distressed patients. It's a challenge to manage activities in a ward, but it is highly beneficial. And I think everybody understood that by now. And let's talk about facts. When I started 3 years ago, there was activity coordinator working only part-time. Then they increased to a full-time. And only recently, management decided to hire another activity coordinator. So there are 2 of us in a ward. So that proves that activities are very much needed in our ward. Volunteers play a massive role in a timetable. Like I mentioned before, they're part of the schedule. And let me mention them all. I've got 7 volunteers. It's lovely Laura, who is coming with her amazing dog Orla. She's a Whitney Irish Terrier, and she turned 7 last month. And she's coming every Monday. On Wednesday, we've got Calvin, who provides fitness club session. On Thursday, we've got Tara, who is doing mindfulness meditation. Also, we've got Davey, who comes once a month, and he plays guitar and he sings. We've got Katie, who comes every 2 months, and she plays ukulele and she sings like an angel. And we also have Jeannie and Maureen, who are coming occasionally, and they are violinists. All of them are amazing, and I treat them as a part of the team. Like I said before, it's very important for us, for activity coordinators and for patients, to encourage patients and motivate them to occupy them in the ward. So a clinical staff can focus on a clinical task, while volunteers, when they're on a ward, they just focus on a patient and rather than a clinical aspect of the patient. They bring human kindness into this busy hospital life, where quite often nurses don't have that much time or enough time to spend it with them, because there are much more to do as well on top of looking after just the patient. And volunteers are a great and fantastic contribution to the team, and they act more like friends to the patients. When they come to our ward, patients ask millions of questions. I'm not entirely sure if I mentioned before that we are a closed ward. We've got only 10 beds, and quite often patients, they don't have much contact with the outside world, especially at the beginning of their admission. They've got passes later on, but they're only like two passes per day, in the morning, in the afternoon. So they're basically stuck in here, and there is not much to do for them. In the past, they were just waiting from one clinical review to another clinical review. Afternoon activity timetable has been introduced, and when I started bringing more volunteers to the wards, things have changed, and patients are not escalating as much, and they are not as bored as much, and they are not complaining as much. Every Monday, I'm organizing Blackford Bladder, and I'm getting feedback from the patients, and they tell us how important activities they are for them, and the volunteers who are providing those group activities. Because in my ward, most of the time, we are organizing along with volunteers group activities, so everybody's involved. Like I mentioned before, patients are spending most of the time, if not all the time, in a ward. So I don't want to exclude anyone from activities. That's why everybody's welcome. And personally, to me, volunteers are inspiration to me, and I do learn a lot from them. Whenever they're absent, I'm trying to cover their sessions. I remember when I started doing mindfulness meditation, and it didn't go well. But after second, third time, finally, I was managed to do it, just because of Tara, one of our volunteers, and I was watching her and observing and taking tips from her. So that inspiration to me, and they're like a fresh wind whenever they come to the wards. And like I mentioned before, they are part of our team. That's how I look at them. And thank you so much.
Thanks, Monica. Thank you. It's really lovely to hear you talking so passionately about volunteers and volunteering, and how you really kind of have them as part of your team. And what was coming through really strongly there was also just the difference to the quality of life of the patients in the ward, that volunteers were able to do these activities with them. The difference that makes just sounds as though it's just really, really massive.
Absolutely, absolutely. I'm a bit nervous, so probably yeah, I could say much more and and much better. I'm a bit nervous, I have to say.
You're doing a really great job. I think that you're really articulate about the difference that volunteers make in your area. So, and I know that there's lots and lots of chat going on, and lots of questions in the chat box. So everybody who's listening is really interested in hearing what you've got to say too. So I'll come back to you again in a wee minute. Monica, if I can come back to you, Lynn.
Yep.
You were saying in your introduction that it would be almost impossible for your complementary therapy service to function if it wasn't for your volunteer therapists. I wonder if could you tell us a wee bit more about what you mean by that?
Yeah, of course. Well, I think a good example of that actually was during COVID, when we then had no volunteers within the service for, oh gosh, it felt like forever, didn't it? So prior to the COVID pandemic, I had 16 volunteer complementary therapists. And because I had this high volume of numbers of volunteer therapists, it allowed me to develop the complementary therapy service further in Dundee to extend out into the community. So prior to having that number of volunteer therapists provide a service to patients that were living at home. So I was able to create a complementary therapy outreach service. And prior to COVID, I was just getting to the point where I was hoping that volunteer therapists could see patients at home, made it a wee pilot, but then COVID came. So like everywhere else, we had no volunteers. So the complementary therapy service was blah. So I was trying to juggle at that time being an acute OT in our palliative care unit, and also when I was allowed to provide complementary therapies to our patients. And I think that was a great example of how the volunteers enhanced the service immeasurably. When they weren't there, we noticed this massive gap that we didn't have the service that we were so used to and that we so appreciated. And I think it also, made me realise that I'm not just a one-man band in all of this. I've got this fab little team therapy together for the benefit of the patients. Thankfully, the numbers of our volunteers are increasing again, and I've got a couple of new ones going through the process of starting. And again, I can already sense the benefits of having them back delivering therapies to the patients and families. I think, also a wee bit of feedback about the volunteers from the patient's perspective. So the patients love the volunteer therapists, and I think it's partly because the patients, a lot of patients in specialist palliative care would be unable to see a complementary therapist, especially for something like massage within a setting out with specialist palliative care. So it's in a safe place. It's someone they know is well trained. It's someone in the workplace, but they're not in uniform. And I think that's a lovely relationship. They develop brilliant therapeutic relationships and kind of know the boundaries, which is lovely. And I think both patients and therapists love seeing one another. I think the volunteer therapists, some of the therapists that come in to us have their own businesses. So they're taking time out of their own business financially and personally and professionally to spend time within our service. So whether that's because they want to give back, they've maybe had a relative in the ward or whatever, and they want to give something back, or whether they know they're doing their kind of community involvement. They each bring their own set of skills, backgrounds, experiences. Some are retired, some have, like I say, got their own businesses. And I think it's also important to say that in specialist palliative care, we try to be good at supporting the volunteer therapists once the patient's no longer around. And through that process, it's unfair for a therapist to have a lovely therapeutic relationship with a patient and then suddenly they're not in the service anymore. So maintaining that good communication and support is something that I try really hard to maintain.
Thanks.
So yeah.
Thanks for that, Lynn. Do you know, there's really so much in that answer. And when you were talking about, do you know, that you weren't able to provide the same service during COVID. For those of us on the session today who are working within NHS volunteering, do you know, that's a story that we know well, and we're still having to, we're still trying to rebuild our volunteering services. But just what a huge difference, not only to you, because that must have been a really difficult and challenging time for you, trying to do your OT job as well as doing the kind of filling that gap that the volunteers weren't able to fill during that time.
Yeah, and it was a huge gap, and I was ever so delighted when they started coming back. Obviously lost quite a number, but but we've got some stalwarts that keep stay with us, and like I say, we've got some new ones, so that's great. Yeah,
excellent. And so thanks for that. So Vicky, I'll come over to you now, and you know, you talked in your introduction about how you can see that volunteers actually contribute to a patient's ongoing rehabilitation. So I wonder, could you maybe explain a wee bit more about that, about the difference that it makes to you and your colleagues?
Yeah, of course. So I think the joy of having a volunteer, so yes, they come in a uniform, they come in a sort of purple t-shirt, but they blend in with the rest of the visitors within the wards. They don't stand out as medical staff. And I think just that ability to spend some really valuable time with some of these patients, some of our most sort of frailest, elderly, can be quite lonely at times. Tayside's quite a wide geographical area as well, so sometimes they don't get visitors, because actually to come in and visit to Ninewells can take them up to 2-3 hours to travel, so it can be quite a lonely time. And I'm not sure that when you look around your environment, a ward's really boring, and you know, the walls are a bit beige, and after you've had all the medical stuff done to you and all the nursing stuff done to you, there's very little to sort of fill that day or to fill that gap. And then people can become quite disengaged with what's going on. They want to maybe just lie in bed, which is the worst thing that they could possibly do. So I think just by having somebody else come in that they can speak to, that they're not interested about why they're in hospital, they want to know about that person. And I think keeping that identity of who you are when you're within a hospital environment is so important. So they're able to spend that time really finding out about that person, what makes them tick, maybe about their previous life experience. You know, we've had ones that have chatted about university careers in the past and sort of helped some of our volunteers in their career progression. And, you know, it's just beautiful to watch those relationships, but I think it just lifts that person's mood while they're here. So yeah, it makes that difference to that person, but it also makes a difference to our staff, because our staff want to be able to give that day in, day out, but unfortunately with some of the clinical demands that we have at the moment, we're not able to do that. So by having somebody else come in who's somebody who's not medical, who's not in a uniform, who, you know, wants to know more about that person to keep that identity, it's just a win-win all round.
Brilliant. And you know, that it's just been a bit, it's been human, isn't it? And it's been there for people, and I see the What Matters to You posters behind you there, and you know, and it all plays into that about what it is that, you know, when somebody's in hospital, they're not just a patient, they're a person. They're a person, and you know, all of these different things really do matter and make a big difference.
Yeah, and often some of our volunteers will come back to us and say, I found out, you know, they come back so enthused after being out, you know, they make some lovely connections and they hear some lovely stories, and it's the human connections that make everybody work, isn't it? And just them coming back to the office and saying, oh, I've heard this about this person, or, you know, this one, and it's great. Or they'll come back and they'll say, you know, because we'll often say that they're quite quiet, we're not too sure what's going on, they're not opening up an awful lot, but they'll come back sometimes and they'll say it's because of X, Y, and Z. And then we have that key, we have that sort of insight, that window of opportunity to then sort of explore it a bit more. So yeah, we love them, love our volunteers. We're fortunate that well, not fortunate really. We started the surgical frailty service the month before COVID hit. So we were desperate to get the volunteers in. So as soon as we reopened the doors to the volunteers, we managed to get a few back in. But yeah, they're brilliant. They make such a difference to our patients, but they make the difference to the staff as well. That, you know, releases some of that special time. So yeah.
Thanks for that, Vicky. Brilliant. So I'm going to take a slightly different tack, Monica, with the next question for you. Now, I think that there may well have been some chat about this in the chat box that I've kind of noticed popping up. But one of the questions that I was really interested to find out a wee bit more about is, do you know, a bit about the training and the ongoing support that volunteers in the unit are offered. Could you tell us a wee bit about that?
Of course. So in that question, probably are mostly focused on Edinburgh Volunteering Hub, because like I mentioned before, we wouldn't have volunteers if not Edinburgh Volunteering Hub. All the volunteers come through them and through those three lovely ladies, Chloe, Mary and Katie. So like I mentioned before, volunteering in the hospital is a partnership between NHS and Edinburgh Volunteering Hub. Volunteering Hub recruits and trains volunteers, and only confident and skilled and experienced end up on the complex wards like IPCU. We share risk assessment responsibility. Volunteering Hub support people to identify the things they're interested in, and patients can become volunteers themselves while they're receiving a treatment. Unfortunately, not the patients from Blackford ward, because we are closed unit, but as soon as they're moved to acute ward, there is a possibility for them and a chance for them to become volunteers too. Volunteering Hub is responsible for induction training and provide with access to mental health awareness training. They provide training on dealing with difficult situations, boundaries and confidentiality, and also recovery training. Also, ladies provide offers regular reviews, one-to-ones and coffee catch-ups. On my side at Blackford, when we have new volunteers, we are responsible for introduction as well. Every time before they come to the ward, I meet with them outside and I give them a little handover, like a hands up. I tell them what's happening in the ward, what kind of patients we have, what kind of atmosphere is, so they know what to expect and there are no surprises. During the session, I'm always there with Arinza, who is another recreational nurse who I mentioned before. So all the sessions are supervised and they're always supported. After the sessions, there's always a time for a chat as well, and the conversation, what happened, how we felt, what it felt, and we share our opinions. And from what I know and from what I heard from ladies from Volunteering Hub and from volunteers themselves, they were saying that Blackford ward is their favorite, because they always feel supported and welcomed and valued and appreciated and secured. And I believe them.
Wonderful. I believe it too. Absolutely do. And you know, this is fascinating. I could continue hogging all of your time and asking you all my own questions, but I know that the chat box has been really, really busy. So I think the best thing to do is we'll move into a bit of a Q&A session, okay, with you, and that's going to be led by Angela. And then if at the time we happen to get through everybody else's questions, I'll have more questions up my sleeve that I can ask you if I've got some time at the end. But I'm really keen that the audience get to participate. So I will hand over to you, Angela.
Sure, thanks everybody. Just before I start, Janice, I just wanted to say that I'd had an email from Pamela and she just wanted to apologise to everybody attending today. She couldn't come along because she couldn't get off the ward for operational reasons, so she did want to be here, so just so everybody knows that. The chat box has been exploding, may I say, not least of all Vicky. Everybody wants the pom-pom with the fork guidance. That is a number one hit.
Val. That's definitely Val, our volunteer.
Yep.
She needs to sort that out.
Absolutely. So that's something that we definitely need to get sorted going forward. That's essential. The next question we had was regarding the recruitment of volunteers. I'm not sure our guests will know much about this. This came from Kathleen Williamson. So she was just wanting to know if the volunteers had to go through basically the kind of same process for staff, like completing forums, compulsory training. So just keen to find out what the volunteers have to go through to get in place. I don't know who would be best to answer that, Janice.
Yep. I don't mind pitching in a wee bit. So when we have volunteers that wish to come to our service, we have a volunteer services coordinator, and they're the ones who do kind of the admin work in the background. So I work alongside our volunteer services coordinators to do the recruitment of therapists, but all other volunteers are through them. They do an interview, an informal visit, look at, you know, if they're going to be a volunteer driver, for example, then it's looking at driver's license, sorting out PVG, references, referral to occupational health. So generally, I think there's an admin section within each service. And I know that Nine Wells, I'm only really familiar with Dundee, but I know the same happens across in Nine Wells. And then often the volunteer coordinators are the ones who, when interviewing the prospective volunteers, work out which part of the service they would best fit and which bit of the service would best fit them. So I don't know if that answers the question, but that's a bit of a ballpark as to what happens here in specialist palliative care in Dundee.
Thanks so much for that, Lynn. Monica or Vicky, do you want to add anything to that?
Unfortunately, I cannot add much because those three ladies from Edinburgh Volunteering Hub, they do all the job, Chloe, Mary, and Katie. So whenever I feel that I need another volunteer and I want the support, I always contact with them, and they're always helping me with facilitating a new volunteer. But they go through the whole process, etc. So that would be a question to them.
Sure. Vicky, I don't know if you want to add
so
anything
similar
there.
to Lynn, we have two coordinators here, Val and Kenny, who do the acute care stuff. So basically I go up to them and just beg, say, please, 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 can I have another volunteer? And they go, yeah, okay, Vicky. I think it's just so that actually I get out their office and stop annoying them. But yeah, they coordinate all the paperwork, all the forms, and then they come down and they make an introduction with us. Again, they, as Lynn said, they will match a person to a particular area or service, and then introductions, and then we basically then take the volunteer. Sounds like we steal them, but we then take the volunteer and then show them around the area, and we go from there. But if the volunteer has any problems, they either come to us or they can go up to the hub and speak to them. So yeah, there's great links in between them, but they do all the paperwork side. So actually it makes our job an awful lot easier, doesn't it? We don't have to worry about any of that side of things. We've just got somebody who's willing and ready to be hitting the shop floor, so to speak.
Thanks for that, Vicky. Janice, anything you wanted to add there on that topic? I know that Janice and I worked in a refresh of an induction course online on Turis for volunteers. So I know that there is, you know, an essential induction course that they have to go through as a bare minimum. Janice, do you want to come in there?
Yeah, I mean, I think that it's broadly similar right across the NHS in terms of, you know, how we recruit, support and train volunteers. And I think that this is an appropriate point to say just what a wonderful job all of the staff who work in volunteer management, volunteer coordination roles, admin support roles for that do, because without them and the work that they do, then we wouldn't have all these wonderful volunteers able to be out there doing what they do in our wards.
Great, thanks very much for that, Janice. Absolutely, right behind you there. The next question we had came from Janine Stenhouse, and Janine wanted to ask us, do you find there is what difference, if any, do you find between the volunteers who are therapists and therefore they are trained, qualified and experienced versus volunteers who are maybe less trained or less qualified? Does anybody want to come in on that?
I'm assuming talking about complementary therapists in there. And I think we have, gosh, I think it's about 160 volunteers working within specialist palliative care services just on the site that I work in specialist palliative care. And I think I don't think it really matters. I think each volunteer within their own right comes with their own skill set, whether they have a qualification or not. It just so happens that the volunteers I work with are therapists who need to have a qualification in order to do what it is that they're doing with our patients. So whether someone's trained or untrained, I think really makes no difference whatsoever in terms of them being able to be as active as a volunteer. I'm not sure if that answers the question.
Sure, thanks for that, Lynn. Vicky or Monica, do you have anything to add on to that?
I think it's just about somebody being enthusiastic for the role, isn't it? Show that passion, that want to spend time with patients and families and to speak to people. So I think if you've got no formal training or experience, it doesn't matter as long as you're enthusiastic.
Yeah.
It's a want that that you do, and these people obviously do, because they wouldn't give up their precious time to spend that with us and our patients. So yeah.
Thanks, Vicky. That's great. Monica, do you want to add anything?
Yes, I totally agree. Our volunteers, they come purely because they want help, and is what they do. It's just their passion. We've got Katie who plays ukulele, and she comes during her break, during her lunchtime from work, and she comes to play. And I don't think that she's doing for her living. It's just she wants to help. The same all the other volunteers. So passion, enthusiasm, and willing to spend a bit of their free time with our patients.
Yeah, absolutely. Like so much in life, it's not so much sometimes about the qualifications, it's about what the person brings to the role themselves, isn't it? Janice, do you want to add anything, or will I go on to the next question?
No, just I'm happy for you to move on, but also I would say that if anybody wants to come in and ask a question, then from the audience, more than just stick your hand up, and we'll invite you on to ask your question if you would prefer to do that.
Sure. Thanks, Janice, for reminding me. I never offered that out to people. Louise Wheeler was querying in the chat, do we find that there is a tendency for a particular age group to volunteer, and can there be a challenge in retaining volunteers? For example, a young person may wish to support the community but perhaps leave, have their input recognised to support future applications. Do Lynn or Monica or Victoria want to come in there?
Yeah, I know that when volunteers are recruited within our service, I think it's suggested that they commit for 6 months in terms of being able to provide that, given all the training and recruitment process that it takes. So I think 6 months is generally what's asked of from people, and I think that probably works quite well, even if someone's a student and they are leaving school and they want to just get a bit of experience in a clinical setting under their belt before they maybe go to do nursing or medicine or OT or wherever. So I think that's completely appropriate. I think it's about the quality of the time that the volunteers spend with you. It's not so much about the length of time as in years and years. I mean, we've got volunteers though in our service. Just recently we had a volunteer who retired after 24 years, and that's phenomenal, but we can't expect everyone to be in a position to volunteer themselves for 24 years. So I think here we just really appreciate the time that we do get from folks. And life for everyone's tricky sometimes, and things come up. Volunteers have their own family crises, or just like the rest of us, but they're in a position that they're volunteering, so they can't always commit to volunteering, I guess. I think but everyone, I think, does it with the best intentions, and it's great if they can volunteer for a long period, but I don't think that's completely essential to get great skills from people.
Yeah, I would
Thanks.
echo that, Lynn. It's they can give us 10 hours, they can give us 100 hours, but that perhaps half an hour spent with one patient, that's
Absolutely.
the biggest thing to that person at that time, and that's more than we can ever ask for.
Yeah.
Yes, I don't think that we're limited to any time frame in terms of volunteers servicing volunteering. They stopped doing it for various reasons. I mentioned Jeannie and Marine who are violinists, and one of them started uni, and she said that unfortunately they will be doing it less often because she's got her own future commitments. But we have had our volunteers for more than a year so far, and from what I know, none of them really want to stop doing it. I think the only issue or problem, which would be, like Lynn mentioned before, their own problems with their own lives or plans for the future, etc. But we are not limited of any time frame, like half a year or a year, that allowed to do it, or any sort of things.
Sure, thanks very much for that, everybody. Christine Johnson had asked a question. Now, Lynn, you kind of covered this in one of your answers to see if they'd noticed a dramatic drop or a change in your numbers of volunteers post-pandemic. There seems to be a decrease in the world and people who want to give up their time. So, Lynn, I know that you kind of covered that in your answer. Vicky, have you got any experience of that? Have you noticed a drop in your numbers? Are they coming up again?
Yeah, so obviously our service started just before the pandemic hit, so we didn't have any volunteers until after. But we started with 1 or 2, we're now up to 5, so it is increasing. And I think as time goes on, again, I think once people probably start to speak to each other and say, I go and I do a bit of volunteering, I really enjoy it, because again, they get some joy out of it. There's, you know, some pleasure taken there, that encourages it. I think I'm right in saying that Tayside's got about 500. Val will probably shoot me because I've probably got it very wrong. And I think within acute care there's 122. So that to me is quite a large number. That's 122 people that want to give up their time and to spend that with people. And you know, yeah, I think that's just an amazing commitment from everybody to want and do that. So yeah, hopefully numbers are continuing to increase, and that there's more and more out there. Ours are very sort of activity based. I know that there was in the chat about food, fluid and nutrition, so there are other volunteers out there that will offer sort of a tea trolley type service that will go around to help with afternoon cups of teas, etc. So there's all different, if anybody's thinking about volunteering, there's all different roles to fit whatever you want, essentially, because we need you. So we'll make anything work.
No, that's great to hear. Monica, have you got anything to add on there? Any changes in your volunteers, pandemic or post-pandemic?
Actually, I started working for NHS only over 3 years ago. And for 2 years ago, I was located at the office as a ward clerkess. And only over a year ago, I was moved to a new role. So unfortunately, I cannot add much to that. But my previous former activity coordinator had only 1 or 2 volunteers. Now we've got 7. So definitely things are improving.
That's great, Monica. Thanks for sharing that with us. Lynn, I don't know if you want to add anything to what you said earlier, or you want me just to move on.
I think the volunteers that I lost were volunteers that were maybe likely to finish anyway because of their age or personal circumstances. So, you know, whilst I did lose some volunteer therapists, like everyone else, the numbers are starting to increase again. So yeah, the future's bright, hopefully.
That's great to hear. Thanks for that, Lynn. Susan McLaren asked a really interesting question. She said, we've talked about the benefits to patients and also the benefits to staff, but do we have any sense of how the volunteers benefit? So does anybody want to come in there?
Yes, I'll go for it. I don't know that we formally collect anything. So I'll hold my hands up, I don't know. But I do know that when we're seeing them out on the wards and we're seeing them coming back in after their sort of shift to sign out on the sign out sheet, how enthusiastic they are about it, how they've met some amazing people out there, just how they've managed to get 2 or 3 patients speaking with each other, and then that leaves that lasting legacy within that bay as well, doesn't it? You know, they've perhaps brought people together, or so just seeing that sort of passion when they come back in from being out there, and I think, yeah, I think somehow the more they do, the more they keep coming back to it. It becomes probably quite addictive, really.
Wow, that's great to hear. Monica, oh, sorry, Janice, you want to come in there?
The reason I wanted to just jump in there before the thought goes out of my mind, Angela, is that in terms of that experience that volunteers have and the benefits to them of the volunteer, we're actually in the process of finalising a volunteer experience evaluation report. So earlier this year, 5 NHS boards participated in a survey to volunteers, which asked them a number of questions about their own experience and the difference that volunteer makes to them. Overwhelmingly positive, I have to say. Overwhelmingly positive, people talking about the benefits to them, to building their skills, to making new friends, to just seeing the difference that they make to patients and staff, gives them what they need. There's so much in that report, so that's going to be published on our website, and hopefully later on this month, if people are interested in taking a wee look at that when it's finalised.
Thanks for that, Janice. That was a great reminder there, and we will put it out when that's published. We'll circulate for anybody that wants to have a wee read through it. Monica or Lynn, do you want to come in there about any noticeable benefits you feel you've seen in their volunteers?
Yes, so from what I was talking to volunteers, they do it for different reasons. We've got few young volunteers who are studying psychology, for example, and they're coming here to gain some experience as well. So it's like a dual benefits. We take something out of them and they take something out of us, and that works perfectly. We've got Davy and Laura who are retired, and they're doing it just from the pure good heart, or kind of occupy themselves and make their life a bit more interesting as well, and come and support us as well. So, or like mentioned Katie, who is coming during her lunchtime at work as well. So yeah, various reasons.
Thanks, Monica. Lynn, I don't know if you've anything to add there.
I would just echo all of those things. I think the volunteers, therapists that come in, I always like to have a bit of a debrief with them, because obviously they're in a therapy room alone with a patient, and a patient can be quite open and honest and share some difficult feelings and situations, and have some quite difficult conversations. So I always try and encourage the volunteer therapists to have a bit of a chat if they need to, a bit of discussion, a bit of reflection, and I always try and feedback a little bit to the volunteers from what things that patients have said, so that they're not going away thinking, well, I wonder if they really enjoyed that, or I wonder if I actually made a difference. So I feel it's my role to try and be a bit of a bridge between the patients and the volunteers, so that the volunteers know that they're getting really positive feedback.
Perfect. Thank you so much for that, Lynn. I could go on. There's tons and tons of questions. What we decided, we knew there probably would be a lot of questions. So if we don't get through them all, we'll produce an FAQ document after the webinar, and we'll put the questions too, because I see that we are running kind of out of time. Do you think we've got time for one more question, Janice?
Yeah,
Yes.
One, maybe two if I push, Angela. Let's see how we go.
Sure. You can just tell me when to stop. Janine Stonehouse was asking, how do you decide on the maximum number of volunteers in your locations? Does anybody?
I don't want a maximum number. Come on, and you come. The more the merrier. The more I can provide an amazing service to the patients that we have. I think if someone approaches our service saying that they're a complementary therapist, if they have the right qualifications and skills to come and volunteer in our service, I'll find them somewhere. I'll find them something to do, a patient to see, a family member to see, or support staff, you know, whatever, if someone's offering their services, I think it's our role to actually to use that and appreciate it and embrace it at all costs.
Thanks, Lynn. I love that enthusiasm there. Vicky or Monica, do you want to come in there?
In my ward, I believe in intensive psychiatric care unit, I think the only limitation would be skills, confidence, and experience, because is what I mentioned before, we need those 3 factors for a person to have to actually deal with our highly distressed patients, and that's the only limitation.
Yeah, quite right, Monica. Vicky, I don't know if you want anything to add on there.
Yeah, there's definitely no limit. There's always somebody out there that needs their help. So yeah, absolutely no limit at all.
Perfect, that's great to hear. The next question is from Amy Walker, and it's directed primarily at Monica. And what Amy was saying to us, she was really keen to hear what kind of training is provided to your volunteers, because it's a closed ward environment, and also what kind of spaces are utilised in the ward to minimise the risks. I don't know if that's something you can fill us in on just now, Monica.
Yeah, of course. I believe that during round 2, I answered partially that questions about training, and I focus mostly on Edinburgh Volunteering Hub, that they provide all the training. From our side, like I'm doing a quick debrief before they come in, and hands up before they come in, supervised visits, and after a quick catch up, how it went, how we felt, etc. Usually I'm using games room with open patio doors. Is where mindfulness meditation is happening with Tara, is where fitness club happening with Calvin as well. There is always like staff present on the corridor, because the room is located quite close to the exit doors as well, to the office doors. And in the office, as you could believe, there are always some nurses making notes and phone calls and emailing, so there are always staff. So if I need someone, obviously we always have a personal alarms as well if something is happening. They're very close to that room to come and help with the situation. So usually those rooms.
That's brilliant, Monica. Thanks very much for filling us in there. So as I say, we could go on and on and on all afternoon with the questions. They're just coming in and coming in and coming in. So we will produce an FAQ document after the webinar, and we'll ask our guests today to fill in the questions that we've not been able to get to. Janice, are you wanting to do a wee tidy up?
Yeah, thank you very much. And thanks, Angela, for some fantastic chat box hosting there. Yeah, I mean, just as we come to the end, I think that it's so inspiring, and it's just been absolutely fantastic to hear directly from the people who work alongside volunteers on the difference that it makes day to day, and sort of in 3 very, very different environments, I have to say. So it's been really uplifting, it's been really heartwarming, and I think that everybody will go away from the session today understanding a wee bit more about the difference that volunteers make to NHS services. So a huge thank you to Lynn and to Monica and to Vicky for sharing your experiences with us. To Angela, to Linda, to Stu and Alison for all of their help and support in the background and making today happen. And I think only fair to say a really special thank you to all of our NHS Scotland volunteers. And I know some of you are there on the webinar with us today, and I can't tell you just how much we really appreciate everything that you do. So thank you for that. And so that's really it for today's session. Before you leave, I would be really, really grateful if you could take a couple of seconds to complete your evaluation poll. It should be popping up on your screen any second now. Your feedback really helps us to improve our webinars for future. And so, yeah, thanks very much for joining, everyone. That's all for me. Enjoy the rest of your day.